In 2023, the White House released a comprehensive health report on President Joe Biden, then aged 80, revealing a history of successfully treated non-melanoma skin cancers. The report also disclosed Biden's ongoing management of atrial fibrillation, a common heart rhythm disorder, and seasonal allergies. Significantly, the report acknowledged Biden's previous diagnosis and treatment for prostate cancer. Biden's prostate cancer journey began years earlier, prior to his vice presidency under President Obama. The cancer was detected through routine screening, highlighting the importance of early detection. Following his diagnosis, Biden underwent a course of treatment tailored to his specific case. The White House report emphasized that Biden's cancer had been successfully treated, with no evidence of recurrence. Regular follow-up appointments and monitoring were in place to ensure his continued well-being. The disclosure of Biden's prostate cancer history served as a reminder of the importance of proactive healthcare, particularly for men as they age. It also underscored the advancements in cancer treatment and the potential for successful outcomes with early detection and appropriate intervention. The Gleason Score is a critical tool in the assessment of prostate cancer, providing valuable insights into the aggressiveness and potential behavior of the disease. This scoring system is essential for both patients and healthcare providers as it helps in understanding the severity of the condition. Developed by pathologist Donald Gleason in the 1960s, this scoring system has become a cornerstone in prostate cancer diagnosis. It helps physicians determine the most effective treatment strategies and predict long-term outcomes for patients diagnosed with prostate cancer. The system has been refined over the years to improve its accuracy and reliability. The Gleason score is based on the microscopic appearance of prostate cancer cells obtained through a biopsy. During a biopsy, small samples of prostate tissue are collected and then examined under a microscope by a pathologist. Pathologists examine the tissue samples for patterns of cell growth, assigning a grade from 1 to 5 based on how closely the cells resemble normal prostate tissue. This grading process is meticulous and requires a high level of expertise. A grade of 1 indicates well-differentiated cells that closely resemble healthy tissue, while a grade of 5 signifies poorly differentiated cells that are highly abnormal in appearance. The more abnormal the cells look, the higher the grade assigned. To calculate the Gleason score, pathologists identify the two most predominant patterns of cell growth within the biopsy sample. These patterns are then graded individually. These two grades are then added together to generate a score ranging from 2 to 10. For example, if the most common pattern is graded as 3 and the second most common pattern is graded as 4, the Gleason score would be 7. A lower Gleason score, such as 6 or below, suggests a less aggressive cancer with a better prognosis. Conversely, a higher score, such as 8 to 10, indicates a more aggressive form of the disease with a greater likelihood of spreading to other parts of the body. The Gleason score plays a pivotal role in guiding treatment decisions for prostate cancer patients. It helps doctors to tailor treatment plans that are specific to the severity of the cancer. It helps physicians determine the most appropriate course of action, which may include surgery, radiation therapy, hormone therapy, or watchful waiting. Each treatment option has its own set of benefits and risks, and the Gleason score helps in weighing these factors. Understanding the Gleason score empowers patients to make informed decisions about their healthcare journey. By knowing their score, patients can work closely with their medical team to achieve the best possible outcomes, ensuring that they receive personalized and effective care. President Biden's prostate cancer was assigned a Gleason score of 9 and a grade group of 5, indicating an aggressive form of the disease. These scores reflect the findings from the microscopic examination of his biopsy samples, revealing a high degree of cellular abnormality and a greater likelihood of the cancer spreading to other parts of the body. A Gleason score of 9 represents a high-risk category for prostate cancer, suggesting that the cancer cells are poorly differentiated and have a higher growth rate compared to lower Gleason scores. This aggressive nature increases the probability of the cancer spreading beyond the prostate gland, potentially affecting nearby lymph nodes, bones, or other organs. Similarly, a grade group of 5, the highest possible grouping, further underscores the aggressive nature of Biden's prostate cancer. This classification signifies that the cancer cells are highly abnormal in appearance and behavior, posing a significant threat to the patient's health. The combination of a Gleason score of 9 and a grade group of 5 necessitates a proactive and comprehensive treatment approach to effectively target and control the disease. While these scores indicate an aggressive form of prostate cancer, it's essential to remember that each patient's experience is unique and treatment outcomes can vary based on a multitude of factors. Section 4. Prostate Cancer's March. Understanding bone metastasis. Prostate cancer, in its advanced stages, can spread to other parts of the body, a process known as metastasis. This spread is a significant concern because it indicates that the cancer is no longer confined to the prostate gland and has become more challenging to treat. One common site of metastasis for prostate cancer is the bones, particularly the spine, pelvis, and ribs. These areas are rich in bone marrow, which provides a conducive environment for cancer cells to thrive. When prostate cancer cells reach the bones, they can disrupt the normal bone building and bone resorbing processes, leading to pain, fractures, and other complications. This disruption can weaken the bones, making them more susceptible to breaks and other injuries. Bone metastasis occurs when cancer cells break away from the primary tumor in the prostate gland and travel through the bloodstream or lymphatic system to distant sites in the body. This journey is facilitated by the cancer cell's ability to invade blood vessels and lymphatic channels. The bones provide a fertile environment for prostate cancer cells to grow and multiply, as they contain growth factors and other substances that promote tumor development. These growth factors can stimulate the cancer cells, encouraging them to proliferate and form new tumors within the bone. Symptoms of bone metastasis can vary depending on the location and extent of the spread. Some patients may experience severe pain, while others might have more subtle symptoms that gradually worsen over time. Patients may experience bone pain, particularly in the back, hips, or ribs. This pain can be a dull ache or a sharp stabbing sensation, and it often intensifies with movement or pressure. The pain may be constant or intermittent, and it may worsen at night. This nocturnal pain can disrupt sleep, leading to fatigue and a decreased quality of life. Other symptoms include fractures, weakness, fatigue, and elevated calcium levels in the blood, which can lead to nausea, vomiting, and confusion. These symptoms can significantly impact a patient's daily activities and overall well-being. The diagnosis of bone metastasis typically involves imaging tests, such as X-rays, bone scans, Connecticut scans, or MRI scans. These tests help doctors visualize the extent of the cancer spread and plan appropriate treatment strategies. These tests can detect abnormalities in the bones, such as areas of increased density or bone destruction, that are characteristic of metastatic cancer. Identifying these abnormalities early can be crucial for managing the disease effectively. Treatment for bone metastasis aims to relieve symptoms, slow down cancer growth, and improve quality of life. This may involve a combination of medications, radiation therapy, and other supportive measures to help patients manage their condition and maintain their daily activities. Section 5. Hormone-sensitive prostate cancer, a beacon of hope in treatment. Hormone-sensitive prostate cancer, also known as hormone-dependent prostate cancer, is a type of prostate cancer that relies on hormones, particularly testosterone, to grow and spread. This type of cancer is often diagnosed in its early stages, where it can be more effectively managed with targeted treatments. Testosterone, a male sex hormone produced primarily in the testicles, stimulates the growth of prostate cancer cells. Understanding the role of testosterone in the development and progression of prostate cancer is crucial for developing effective treatment strategies. In hormone-sensitive prostate cancer, reducing testosterone levels or blocking its effects can effectively slow down or halt cancer growth. This approach can provide significant relief from symptoms and improve the quality of life for patients. Hormone therapy, also called androgen deprivation therapy or ADT, is a common treatment approach for hormone-sensitive prostate cancer. ADT can be administered through various methods, including injections, oral medications, or surgical procedures. ADT aims to lower testosterone levels or prevent testosterone from reaching prostate cancer cells, effectively starving the cancer cells of the hormones they need to thrive. This can be achieved through medications that either reduce the production of testosterone or block its action on cancer cells. This can lead to tumor shrinkage, slower disease progression, and improved symptom control. Patients often experience a reduction in pain and other symptoms associated with advanced prostate cancer. There are various methods of ADT, including medications that block the production of testosterone in the testicles, such as luteinizing hormone-releasing hormone agonists or antagonists. These medications can be administered through regular injections or implants, or medications that block testosterone's effects on prostate cancer cells, known as anti-androgens. Anti-androgens are often used in combination with other hormone therapies to enhance their effectiveness. The choice of ADT medication and treatment duration depends on factors such as the stage and grade of the cancer, the patient's overall health, and potential side effects. Personalized treatment plans are essential to ensure the best possible outcomes for each patient. While hormone therapy can be highly effective in controlling hormone-sensitive prostate cancer, it's essential to note that most prostate cancers eventually become resistant to hormone therapy, leading to a condition called castration-resistant prostate cancer, or CRPC. This transition marks a more challenging phase of the disease. Ongoing research and clinical trials are exploring new treatment strategies for CRPC, aiming to improve outcomes for patients with advanced prostate cancer. These efforts include developing novel medications, combination therapies, and personalized treatment approaches